Madam Speaker, since my young days, I was taught that there are always two courses of action in life. There are two ways open to man. One is the good way, the right way, and the other is a pleasant way. Both have different objectives. Both ways approach a man, but the wise man, he chooses the good path, the righteous path, and reject the pleasant one. Both paths are wide open to man. Both comes to us. Both are at our disposal. Nectar and poison, both are kept in 2 cups before us. Drink whichever you want. The glamour of poison kept in a beautiful cup is more attractive than the nectar. All that glitters is not gold, go the saying. But the foolish, the opportunists, and those who have mean and hungry looks, they accept the pleasant way. They cannot withstand the temptation. This is exactly what the MSM regime had done in the ignorance and lust for power. They accepted the pleasant way, the easy-going life, and in so doing, they have dragged our country toward the slippery slope of financial and economic destruction and ruin. They have mortgaged the future of our children. The right path is sharp and narrow at the edge of a razor. But the present government and the leadership of the Prime Minister and the Deputy Prime Minister has taken the rightful path. It may seem bitter, but we know the future will be bright. Tomorrow's harvest depends upon today's plowing and sowing. But if for fear of bad weather, we do not plow and sow today, we will have no harvest tomorrow. This is exactly they have done. They were static, they were stagnant, and they were swimming dans la mare de corruption et népotisme. There is a saying, he slept beneath the moon, he basked in the sun, he led a life of going to do, and he died without doing none. This is what they have done. The case of the previous government, only talking and no action, and this is what has happened to our country. They have been plucking the fruits without watering the plant. And you know what happens if you only pluck the fruits, you don't water the plant. They were milking the cow, they were not feeding the cow, and the end result has been disastrous today for their entire community. They have dried up everything, they have finished everything, and they have the guts and courage to come in front of the public, and they are trying to tarnish the image of the government. Truth is bitter, truth is naked, and public will come to know tomorrow what was the truth. They have completely destroyed the economy of this country. Those crooks who are steeped in ignorance and arrogance do not know the future, the history of this country. Our ancestors had done a lot for the country. We are proud of their achievements. They disapproved the great predictions of great economic laureate James Meade, who predicted that the future of Mauritius would be doomed. We will have a gloomy future. It is no denying the fact that the father of the nation, Sir Shiv Sagar, had the vision and the foresight to bring Mauritius on the forefront of the world. We say bravo to him. We bow before the work that great man had done to prove even economists of those days wrong. Even the Nobel Prize winner, V.S. Naipaul, described Mauritius as an overcrowded barracoon in 1971. He was also proved wrong. The credit goes to our ancestors because they got their education from the school of suffering. We taught them the formula, strive, struggle, sweat, and succeed. And we have succeeded in making a modern Mauritius today. Free education and welfare state led to unprecedented progress. We became the poster child of development. We were known as the star and key of the Indian Ocean. The spirit of belonging and patriotism was entrenched in our culture of unity in diversity, anekta mein ekta. That is unity in diversity. That is the characteristics of our nation. Unfortunately, all that we had achieved crumbled down like packet of cards in the last 10 years. The sanctity of our key institutions were desecrated, defiled, and defamed. From the hallmark of democracy, we were reduced to the status of autocracy and dictatorship. They even dared to desecrate and sully the sacred lake of Ganga Talab, where the Prime Minister of this country had poured the Ganga Jal into it, where Shivsagar and Gulam toiled and moiled to keep that place a sacred place. A former minister was engaged in stag party with wine-wells women at a time when the country was reeling under the distress of confinement following the COVID-19 pandemic. And these people have the guts to come in front of the public and they are criticizing the work that is being done by this government. It's a shame for them. The reign of terror, the reign of terror and political vendetta crippled the health of this nation. It created economic and social havoc. Anyone who dared to raise his head were persecuted and even detained in jail. Hundreds of innocent citizens were under provisional arrest. I was under provisional arrest. Our Prime Minister was under provisional arrest. That was the darkest period in Mauritian history. In the history of Mauritius, the greatest number of political charges as political opponents were during the reign of Pinocchio and Lady Macbeth. Everybody knows. Never in the history of Mauritius had never known so many provisional arrests. Every day, starting from the morning till late at night, they were catching people, putting them behind the bars just because you had the guts, the courage to raise a voice against those people. They had stooped so low that even Holy Virgin Mary was not spared. A former commissioner of police made improper remarks and attacked a particular community. Immorality, corruption and nepotism, large-scale frauds reached its peak. I'm not saying so. The then Prime Minister, Praveen Jagannath, he made a honest admission. He made a honest admission when he said, I'm quoting him, mafia has infiltrated all key institutions of this country. He said so. And of course, if this is not an avowal of failure of state capture and kitchen politics, what do you call it? The destiny of our lovely, great little country, as Mrs. Gandhi used to say, the great little country was under the whims and caprices of a Lady Macbeth who was controlling all levels of power. Power corrupts, and absolute power corrupts, absolutely. Power blinded them to such an extent that they didn't hesitate to drag a former Prime Minister from his house by his collar and brought him before Central CID to Kazan Central on frivolous charges. And all these charges were dismissed by the court. I remember, I have to speak it out. When the Prime Minister of India visited Mauritius in 2015, there was a delegation comprising of the President of the party, Dr. Arvind Bolel, Sakil, myself, we met him. And I don't hesitate to say, I asked him a question, that when you became the Prime Minister, what was the first action you did? He smiled. I replied that you went to the former Prime Minister, you bowed down, you touched his feet. But that had not been the case in our country. Our Prime Minister took handcuffs and moved out of the house of our former Prime Minister. That makes the whole difference. He did not say anything, he stayed put. I still remember, but he realized what I was telling. Mauritius was so, this makes a whole difference. Here we are treated as enemies. They treat their adversaries as adversaries, not as enemies. Mauritius was brandished as narco state under drug mafia who reigned in all impunity. Government de Nulame was a phrase coined in the time of MSM. Can you forget how Franklin, the notorious drug peddler, was benefiting from occult protectors from higher quarters? Can you forget that? Have you forgotten that tractor pole full of drugs worth millions of rupees passed under the note of the Prime Minister and the Commissioner of Police during an official function as a harbour? Even have you forgotten all this? The MSM government precipitated, rushed to blame COVID-19 pandemic to justify the economic woes of the country. And taking this as a pretext, they printed 180 billion of rupees. This is the worst thing that somebody could have done. That is, the country were reeling under the grip of problem, of disease at that particular moment. they took their opportunity just to start printing money. In 2019, they took 19 billion rupees from the Reserve Bank of Mauritius to finance electoral promises of raising the basic retirement pension. COVID-19 came as a manna from heaven for the cronies of MSM. Loot, mar, as much as you can loot. You can try to take as much as you can. A series of emergency procurement contracts were forked out to coping of ministers. Even the Bank of Mauritius, the State Trading Corporation, became piggyback for those holding power or those close to corridors of power. Abuse of power and misuse of public funds became the mantra of the day. Madam Speaker, dozens of murders and kidnapping. Can we forget also? Corruption was there, fraud was there. What about murders within inverted comma? Dozens of murders and kidnapping took place during that time. The former government, they had blood in their hands. Shakespeare through Lady Macbeth, who have said, all the perfumes of Arabia will not sweeten my little hands. That was the situation in the country. Our memory is not short, but it is not so short that we can forget the cold-blooded murder of Krishna and of Karakia. Strange and terrific news, like procurement officer threw herself from 10th floor building. One committed suicide by hanging under the lavabo, another by hanging with door of cupboard against the knob of a cupboard. Calamity went on and on and on. Everybody remained silent. Nobody could open their mouths. Under the pretext of bailing out enterprises and tourism industry, billions were siphoned off by the MIC. Magajiva benefited more than $1 million rupees of taxpayers' money. And today they come billions. And today they come and they will tell you our government is not doing the right thing. Notorious political agents benefited billions of rupees for setting up even private clinics. They did not even respect our disease, our old, those people who are dying, those people who are not well. At one point in time, private clinics were mushrooming in the country. It was so tempting that even one ex-vice prime minister and minister of health also wanted running off the license to start a clinic, because that is the best way to make money, best way to print money. Can people stoop so low as to play with the health of the nation? The message is clear. Downgrade the public hospital that they have done in this country so that promote their business will flourish. At one given point in time, all the private clinics were full and the public hospitals were empty. This is what they have done to loot our people. Over 10 billion rupees were loaned to big conglomerates. Even land granted for cultural centers were grabbed forcibly to give them back to blue-eyed boys. The case of Royal Green that benefited over 3 billion rupees in another flagrant example of loot-mar. That was not enough. That was not enough. They cast their evil eye on the state land at Anslare, where devotees meet for spiritual festivals. Even that, they eyed that land. And had it not been for the support of the movement led by our friends of the North, even that you would have lost. It's a shame. It's a shame. Naked day robbery. And these people dare to come and speak about philosophy to us. They will go on the streets and they will try to open slogan against our government. BIE was dismantled, everybody knows. Taxpayers had to pay for it, 25 billions. I remember that time the minister, Rosi Badin, openly declared not a single rupee of taxpayers will be utilized, but 25 billion rupees. They grabbed in their search for vengeance. What about Bitarax? And they had to pay 6 billion. Patel and Engineering over 2 billion rupees. It appears we have forgotten the safe Tichi and heritage Tichi, over even billions of rupees was siphoned off. In the system of trial and error, this is how they have looted our country. They bled our country white, as if our country caught jaundice. Mauritius came on its knees. It was suffocating and taking its last breath. That reminds me of the great Indian writer, Hayre Manushya Ki Madurat. Oh, the desire of man, how baseless can be your standing. Madam Speaker, what to speak of the common man? They had no respect even for the poor, the helpless, the sick and the diseased elders. Have we forgotten the fate of our elders? Those dialysis patients, they were treated worse than animals. They were confined, cabin, crypt in, segregated place, left to die without even the basic necessities of life. Among them we had those who had no eyesight, those who were really sick. 5 patients were visually impaired. Total number of deaths from Suyak Dialysis Center was 12. It's known, it's such an insult for our people, our elders, and we know how we treat our elders in our houses. This is heartbreaking, unacceptable. They had undergone unimaginable suffering in isolation and neglect. They were parents and loved ones whose dignity and right to human care should have been protected. Madam Speaker, really speaking, they were left to die. And luckily, our government, under the leadership of the Prime Minister, we have opened up investigations on that, and those who are guilty should be paid at any cost. The ex-Prime Minister qualified the report on the state of the economy as a torsion. Maybe in his days, he used to coerce public officers to produce such type of torsion. Suffice it to tell him that the actual report had been prepared by public officers who are now free to breathe. They can breathe, they can discuss, they can talk, they can move, they can do whatever they want within the limits of the law. Why did they overstate the budgeted income by 26 billion? I was listening, and understate the expenditure by 15.5. Why did they do that? They must know the reason. We do not need to be an economist to detect that this government was cooking the books and cooking the population at the same time. To make matters worse, they overstated the GDP by 73.8 billion rupees. They were living in fool's paradise and wanted population to believe that all is well. During electoral campaign, MSM was speaking of economic boon. It is they who prepared the country to be downgraded. It is they who put the country in the trajectory of narco state. It is they who isolated our country internationally. I remember when Navin Ramgoolam was the Prime Minister, what was the status of our country? You go to Africa, everybody speaks about Mauritius. You go to any part of the world, but these buffoons, they had isolated the country. They dilapidated all reserves and fund of our parastatal bodies. There was a time in this country, I have been minister for almost 20 years, I know, each and every parastatal body used to have, I don't say billions, but millions of rupees in the coffers. You start with State Trading Corporation. I was the minister for 5 years there. Take any department, CB or anyone, but now they have looted all. All reserves have been looted from the parastatal bodies. They took 180 billion rupees from the Bank of Mauritius. They made MIC a coven of Alibaba for MSM mafia to pilferage at the expense of hard-working taxpayers. Who sold the 2 aircrafts at throwaway price? Everybody knows. But nobody speaks about it. Who printed notes that led to disastrous consequences? Who depreciated our rupee? Who destroyed our purchasing power? They are responsible for the skyrocketing inflation. They increased the public debt from 238 to over 600 billion rupees. This amount is accounted one. But in more than that, in my ministry, we are owing 2.2 billion rupees. If they were so good, they were so capable, they would have left so many debt everywhere. I will come on my ministry. I have not come to it now. Why did they consciously crush the economy of this nation? There is a very interesting anecdote in one of our epics. In one of our epics, there is a very interesting anecdote. When Lord Krishna asked the foolish Duryodhana, the evil-minded man, don't you think what you are doing is wrong? Why are you doing that? My Lord, I know what is wrong and what is right, but I simply don't want to do right. So this was the situation there. As Shakespeare would have said, steeped in blood, should I made no more, returning what our teachers has to go over. I'm already in blood. What is the fun of returning back? Let me go ahead. This is what they did. Looted and looted the country day and night. History will recall, Madam Speaker, history will recall the Herculean task of the Prime Minister and the Deputy Prime Minister, who without hesitation presented a budget to save our children, to save our generation. They had the courage of conviction. They have superb values and they have self-respect. They did not cheat anybody. They did not deceive anybody. They speak nothing but the truth. They may look firm. At times, when they were talking about the budget, they look firm. but they are friendly. They appear tough, but they are tender towards the population. They are courageous, but they are compassionate. They believe in innovation. They don't believe in stagnation. This budget is not about goodies. This budget is not about buying people for vicious and malicious motives. This budget is a life-saving medicine for all Mauritians, for our children and our future. We are passing through turbulent times, and turbulent times give us incredible opportunities to come up. I always used to quote one of my teachers, that in all adversities there is in its depths. In all adversities there is in its depths a treasure of spiritual blessing secretly hidden. I believe in that. This government is giving you a stable currency, is controlling inflation, is creating confidence in the country, in public administration, confidence in the Mauritian rupee and Mauritian economy. You know, many people, they hide in themselves when the going get rough. They live in the comfort zone, but the wise are those, they eat their fear before the fear can eat them. And I say, thank you, Prime Minister, you have done it for us. Let us inform the House, and through the House to the nation at large, how the former government, the late government, treated Ministry of Health and Public Health System, Ministry of Health. The public health system was on the verge of bankruptcy. There was a total collapse everywhere. There was lawlessness everywhere. When we took over, there was hardly, Madam Speaker, any penny was left to be spent on essential services such as procurement of medicines, maintenance and repair, among others. The House is aware of the state of the economy, but let me inform you about the state of the health system in this country. What I had observed, neither my pen nor my tongue can describe. I had been minister for many years. I have known victories and defeats. I had known ups and downs, pleasure and pain. But I have never seen a ministry financially naked, bankrupt, down to its knees. Unbelievable, unbelievable. Wherever you look, there was nothing but unpaid bills, bills and bills. Coffers were not only empty, but there was an outstanding debt to the tune of 2.2 billion rupees they had left. Now, MSM is claiming from housetop that they left a flourishing economy. I heard that Buffon, that Minister Sabat, that the economy was booming. This is what is the meaning of booming, keeping a debt of 2.2 billion rupees. I asked, then why the workers of all grades of health, drivers, healthcare assistants, attendants, medical, paramedical staff, doctors, not paid their duly earned overtime for so many months? Why were suppliers of core batteries, maintenance companies, petrol stations, laundry services not paid their services for their services? They had not paid a single cent. Is it not a fact? Is it not true? The supplier of fuel had threatened to stop supply of fuel except for ambulances. The country had gone to such a situation. Even the suppliers of other services had stopped their supply, with the result that all vehicles of ministry were not properly maintained, and many, including life-saving ambulances, were lying idle. Everyday suppliers and creditors were calling at the ministry to demand immediate settlement of their dues. They even shamed us overseas, outside the country. Hospitals which had treated our patients, that is very important for the country to know. Hospitals abroad that had treated our patients had not been paid, and the sum of approximately 200 million had to be paid. They had not paid 200 million rupees. The report of National Audit Office mentions that pharmaceutical products to the tune of 72.5 million were disposed of as rubbish. We had to throw them out. And to add insult to injury, that is worst of it. The worst part of it, insulting part, they had not even paid their dues of over $20 million for COVID vaccine. The vaccines were not yet paid, and the then government had taken 2 rupees per liter of petrol in order to amass billions of rupees kept in their coffers. They did not even pay for COVID, the vaccine. Now we are paying. Now we are paying. Can we forget the Pack and Blister saga? They had purchased 50 defective ventilators. They were never put to use. They were returned to the supplier. We had not even seen the ventilators. And they were returned. They're actually lying in the Freeport in their custody. And we are paying the rental for keeping those rubbish. We are paying it. So we have spent over 100 million rupees in that Pack and Blisters. So whose fault is that? Ours or theirs? Their fault. And now they are trying to put it on us that we are not ruling the country. We have to accept that they constructed oversized, poorly planned, empty infrastructures at great cost. And you know that there had been no human resource planning for many years. The result was 1,500 nurses, record officers, lab technicians, doctors and other paramedical staff in 10 years. They had hardly recruited any one of them. That's why we are in such a situation today. We have to work. We can't still idle. Till the recruitment of staff, we have to encourage our staff to work for the country. I'll fail my duty if I don't share with the House the evaluation carried out independently by World Health Organization. That is very, very bad. Regarding the health sector strategic plan that they had for 2020 to 2024. This was launched in August 2020. The overall target is so alarming and so catastrophic. According to the health sector strategic plan, the life expectancy should have reached 75.5 years in 2024. It is still 73.9. It is a failure, a flop. Infant mortality was targeted to reach 10 out of 1,000 in 2024. We are stuck at 14.3, the same. And the 5 years mortality was targeted to reach 12 out of 1,000 in 2024. It is still 15.4. Maternal mortality ratio targeted to reach 0.35, 2024. It is still high. HIV/AIDS cases was supposed to become zero in 2024. We have 549 registered cases today. It means wherever they have laid their hands has been a complete fiasco. The mortality rate of 5%. As far as non-communicable diseases are concerned, they wanted to bring it back to 5%. It is 13.5% increase in mortality rate. It was a big failure, catastrophic, shocking their plan. This is a real slap on the shameless cheek of those who were in power at that time. We eradicated malaria. We dealt with outbreak of chikungunya as well as dengue, and we succeeded because we had a well-equipped staff. Unfortunately, over the 10 years, they had neglected and destroyed everything to such an extent that I have to announce to the House that dengue has now become an endemic in Mauritius. This is a direct result of criminal negligence on the part of Public Health Department. They have failed, 10 years were lost. The country was bleeding white. Luckily, when all hopes were shattered, the electorate booted them out of power. If they had not done that, the predictions of Meade and V.S. Naipaul would have become true. When the country was at its lowest ebb, the Prime Minister and the Deputy Prime Minister came unitedly to save the nation. The country needed a savior. The country needed a selfless and dedicated being. Both put their differences apart and rushed to rescue the nation that was reeling under the grip of dictators and mafias. I take this opportunity to congratulate the Prime Minister for the budget that he has presented. He has chosen the good path rather than the pleasant path. It is in such a situation that the capacity of leadership quality of a person is judged. A party without a leader is just like a field without water supply. A party without a leader is just like electric wire without power supply. It is just like a class without teacher. That's why the opposition today is leaderless. We have on our side two leaders. Allow me, Madam Speaker, to go to the landmark measures announced for my budget now. There is a provision in my budget for the creation of the post of an ombudsman, and that will be of great news for those my friends who keep on shouting at me. Now I know the work is done. All the complaints will be dealt by the ombudsman. Any case of alleged case of negligence will be dealt by him. The ombudsman will be the voice of the public. He will protect the rights of the patients.
By him?
No, we don't have the name. It's ombudsman. That ombudsperson. I'm sorry, ombudsperson. He will ensure independent and impartial oversight. He will improve transparency and accountability. As far as monitoring of quality of healthcare is concerned, we are operating in a void. In order to address this unacceptable gap, a National Health Quality Commission is being created that will ensure standardization of care through enforcement of national and clinical standards and protocol. The Prime Minister, since long, has been talking about the importance of putting up managers, credible managers in all our big establishments, because the medical experts with no management experience they cannot manage efficiently a healthcare institution. So this is being addressed, and it was he who insisted that 5 professional managers with suitable qualification experience will be recruited for the management of regional hospitals. So apart from the doctors, the directors of health will be having managers at the top. They are going to administer our hospital. When I'm speaker, day in, day out, most of the time, and that of my advisors, was spent in receiving calls from public and in addressing their problems. But now, and if you even keep on hearing people complaining on local radios, on social media, complaining about problems that they have encountered in our public health services. To solve this problem, a 24-hour hotline for public to address a complaint is being created so that the ministry might resolve them in the responsive and timely manner. I had working sessions with the World Health Organization for a new Public Health Act, which dates back to 1925, which is archaic and primitive. Similarly, a new Pharmacy Act will be prepared in order to put an end to the unscrupulous practices prevailing actually in the service. I'm also planning to bring amendments to Food Act, Optical Council Act, Medical Council Act, and Private Health Institution Act. The Food Act is being amended to enable on-site testing. That is, no need to take the food and bring in the laboratory for inspection. The inspectors will come on site, take the samples, and they will try to test it on the spot. And for that, 20 million rupees has already been earmarked. The trust fund for specialized medical care will be revamped. This government is promoting research and capacity building for clinical trials as a prerequisite to drive innovation in medical and health care. Other research projects such as non-communicable diseases and national SALT survey will follow. In that respect, a dedicated division of metabolic advanced cardiac imaging and research will be set up within the trust fund. Funds have already been secured through Professor Derek Yellon and Walker from the University College of London through the intervention of the Prime Minister to kickstart a major research project regarding remote ischemic preconditioning in patients suffering from myocardial infarctions. Advanced metabolic and hormonal testing platform will be rolled out to detect hidden risk factors for non-communicable diseases well before symptoms emerge and lead to persistent treatment. Similarly, diabetes path to remission program will be launched in a phased manner. Our biggest public health problem in Mauritius is diabetes. Nearly 20% of the population are victims of diabetes, and another 20% of pre-diabetic patients. In this very house, there must be over 1/3 of our friends may be suffering from diabetes, they may not be knowing it. So we are launching a new program called the Path to Remission Program, that is PTR. We are taking it very seriously. All the sacrifices of Professor Owens had gone to the drains because of the carelessness of the then government. I assure the House, with the help of international experts, we will meet the challenge. Madam Speaker, we cannot close our eyes on vector-borne diseases like chikungunya and dengue. The former government was so indecent that they had completely given up the vector biology infrastructure. I'm pleased to announce that with the collaboration of senior advisors of my ministry, we are setting up a full-fledged department of vector biology at Sir Sivsagar Ramgoolam National Hospital. Activities will start soon. A sum of 24 million rupees has been allocated for that project. I'm pleased to announce that e-health project will shortly be a reality, and that is starting from the east. Proper health records and long queues will become a thing of the past. We believe in investing in people, not only in buildings. That too, building constructed without the proper planning, and worse, without the collaboration of Ministry of National Infrastructure and ESD. Provisions are made in our budget for 1,000 nurses over the next 3 years, 50 trained midwives, 50 medical health officers, 30 specialists. Budget for training capacity also has been increased. Madam Speaker, you will be probably shocked to learn that over the past 10 years, electrical system and water reticulation system of Sir Sivsagar National Hospital has been neglected to such an extent by the outgoing government that patients are not provided adequate hot water for their showers. I would like to remind the House that works in that direction had already started in 2014, but for reasons known to them, the project was boycotted. Most of the wards do not have safety fire certificate because of neglected electrical system. Sir Sivsagar Ramgoolam Hospital and Victoria Hospital were criminally neglected. A capital budget of 1.8 billion has been allocated to my ministry to support the modernization of the health infrastructure. Allow me, Madam, to give an update regarding other infrastructural works. We will be opening new eye hospital in days to come. We have corrected all deficiencies in the building. The renal transplant unit at Jawaharlal Nehru Hospital, sponsored by the Government of India, is nearing completion. At the same time, I would like to inform the House that kidney transplant is being performed by top surgeons of India in our country. The PET scan, the SPECT scan, DEXA scan at the National Cancer Center was lying idle for almost years. They are being commissioned and will be fully functional in days to come. That is a great achievement. I have to be honest and inform the House that I am not satisfied with the care that was being provided to cancer patients till now. When we speak on cancer, it should be prevention, prevention, and prevention. A major awareness campaign has been launched to sensitize population regarding health lifestyles and early detection of non-communicable diseases in general and cancer in particular. I'm pleased to announce to the House that the mortality rate for cervical cancer has dropped by 40% as a result of national screening program. In high-risk patients for breast cancer, there will be a program for screening by mammography. We are currently in negotiation with India to get an expert in cancer to lead the Cancer National Center. Much emphasis will be laid on early detection and cancer. Madam Speaker, a memorandum of understanding on cooperation in the field of Ayurvedic medicine was signed between Government of Mauritius and India. Such a center would make Mauritius a hub in the region in the field of Ayurvedic medicine. We are finalizing arrangement for that center to be a reality in the near future. Across the world, accident and emergency departments are manned by trained specialists in accident and emergency. Actually, we have 30 doctors trained in accident and emergency medicine, but they are not being utilized properly. The system is being restructured. Accident and emergency department will be led by qualified emergency physician. This will lead to faster triage and higher efficiency in patient flow. This will also lead to advanced standardized care for trauma, strokes, and cardiac arrest. This will also lead to improved survival rates through timely specialized intervention as demonstrated internationally. In Mauritius, we do not have support in terms of interventional bronchoscopy for a number of patients who have certain types of pulmonary diseases. Because of the conditions, they cannot be sent abroad. In that respect, I had discussion with Professor Fayan, President of the Société de Pneumologie de l'Océan Indien, et la Fédération de l'Académie de Médecine de France for support for setting up interventional bronchoscopy services in Mauritius. They have agreed to provide us with necessary equipment and training for these services to be set up. A memorandum of understanding is being finalized. Madam Speaker, every hospital will have patient facilitation desk to streamline patient appointment, wards allocation, follow-up to assist with inquiries. A new family communication system will help doctors and nurses to provide regular updates to relatives, including daily medical progress, proactive outreach during prolonged admission or critical care, support for those unable to visit due to work or distance. This service will strengthen trust between hospitals and communities. Budget also provides for establishment of 5 regional diabetic centers to provide under one roof specialist consultation and education, multidisciplinary care, diabetes specialist nurse support, nutrition, education, food care, renal screening, psychological support, and support for practice of regular exercise. An international advisory committee on diabetes and cardiovascular disease is being set up to bring global best practices into Mauritian medical health care, to provide clinical trials and precision in medicine efforts, to support our expanding diabetes centers through membership and training. Budget includes a new ophthalmology, cardiac surgery, that we are starting in fact soon. The neurosurgery department will be open in the months to come. We are also negotiating with some surgeons from India. Hospital services will include cataract surgery, cardiac bypass, valve replacement that will greatly reduce national and regional waiting times. Actually, we are conducting 5 cardiac surgery daily, but that number will be doubled in the, let's say, months to come. Madam Speaker, presently there is only 1 stroke unit for the whole population at Victoria Hospital. Stroke units reduce mortality of patients by suffering from cerebrovascular accident by up to 20%. This budget provides for the establishment of 1 stroke unit in each regional hospital. We have been provided finance for that work. We have been repeatedly talking about about an aging population. Till now, there is a total absence of geriatric healthcare services in our regional hospital. Again, on the instructions of the Prime Minister, we have decided to set up in all hospitals 1 geriatric ward so that our old ones will be taken care of properly. With regard to substance abuse and harm reduction and HIV/AIDS, my ministry will work in close collaboration with National Agency for Drug Control. Patients living with HIV deserve the same freedom of choice as any other citizen managing a chronic chronic illness. Antiretroviral treatment will be made available both in public and private sectors. The transition to one-pill regime will represent a significant step forward in improving care being provided to HIV/AIDS. With regard to parallel imports of medicine, my ministry will form part of the high-level steering committee which is being set up to accelerate the parallel import framework. We will implement the recommendations of the committee. Madam Speaker, we have to take immediate steps to ensure spending of available fund is optimized. We will ensure that every rupee of taxpayers are judiciously spent. In that respect, we have discontinued the use of Bachoo ECG, AI ECG, a procedure unvalidated in Mauritian population and not in line with evidence-based medicine. This was introduced by the previous government. We have already saved the ministry millions of rupees. Pool procurement through G2G arrangement with India and through SIDS pool procurement program is being looked into to achieve faster and more cost-effective procurement of medical products.
Minister,
Madam Speaker?
Are you concluding, sir?
I'm concluding.
Okay.
What you have heard, Madam Speaker, what you have heard is not a lofty wish. It is a comprehensive action plan for a healthier and more resilient Mauritius. We are transforming hospitals with professional leadership and special care, revolutionizing food safety and legislative frameworks, embedding safety through discharge summaries and clinical audits, protecting our future by targeting childhood obesity, improving patient experience through hotlines, facilitation desks, and family update. These reforms reflect a holistic vision, better health outcome, economic productivity, and resilience against future shock. Health is not a luxury. It is our formulation of national prosperity. This is our moment of national decision to act with courage, unity, foresight. We choose responsibility over populism, sustainability over short-termism, and the health of our people at the heartbeat of the nation. Let us endorse this budget with resilience, compassion, and pride for today and Mauritius tomorrow. In end, I conclude by thanking the Prime Minister and the Deputy Prime Minister who have been the brain, who have been the spring, the fountain of these decisions that have been taken for the welfare of the community. Thank you.
Thank you.